So, hey Joanne, how are you?
I'm good.
Would you mind just sharing a little bit about yourself and your passion for healthcare transitions?
Sure. I was a social worker for 13 years, medical social worker for 13 years. And the last job I had, I worked at Lurie Children's in Chicago, and for 6 years did transition with liver and intestinal transplant patients. And during that time, I recognized very early on that we had adolescents who would turn 18 and then disappear from medical care and show up a few years later in the adult hospital needing retransplanted and struggling with adult providers saying they didn't want to retransplant the adolescent because they weren't following medical care. And what I realized was on the pediatric side, we really spent very little time teaching the adolescent how to be successful in managing their healthcare, and so I became very passionate in wanting to give adolescents and parents and providers tools to help set pediatric patients up to do well in the adult world. And so that's part of having the guidebook now and looking at having checklists that help parents and adolescents think about all the things you need to learn before you would be able to make healthcare decisions by yourself. I think we talked about it earlier, but the example I give is, when a child turns or an adolescent turns 17 and they're able to drive and they get their permit, you wouldn't automatically just give them the car keys and say, go and drive. There's all kinds of things they need to learn before they're independent and being able to drive. And so we should have kind of the same expectations for healthcare. You can't expect an adolescent to know what their medication is for and why they should take it and how it helps them if we don't teach them about those things and engage them in their medical care and ask them to be part of that whole process.
That sounds really good. I have a child that in my mind cannot make decisions and also is essentially nonverbal with people he does not know. And yet I see that when things have been bad for him medically, it really makes him depressed, and I think he feels out of control. So I need to figure out ways to help him feel in control, and I'm wondering maybe what else I can do to help him take care of some of his own medical things.
Yeah. So there's probably already things you're doing that you don't recognize that you do, or he does for his own comfort or to help him in stressful situations. So depending on, what time of day he does better with just being around other people. So if you're going for a medical appointment, do you want to go first thing in the morning because there's fewer people there, or last thing at night because the office is quiet, rather than at 10 o'clock?
So making a lot of little choices.
Yes.
Things that we just do automatically.
Right, and you're doing it automatically without thinking because you're just in a process, especially if he's sick and you're trying to make a decision right away. So sitting down and actually planning before he gets sick, and maybe seeing if he's able to communicate to you what things help him. So, if you've just been in the hospital, being able to ask him now that he's at home, were there things that happened that made you feel better about being there, or were there things that when he was there made it worse? And then writing down that to see how much control you can have or give him in stressful situations. Especially the hospital is really the worst because people come in and out of your room whenever. And it is a big control thing because it's a privacy thing as well, and feeling like you're able to say no to some people, or sometimes grouping medical providers, so asking them all, can you all come within this 2-hour period of time, or you're not allowed to come until this next 2-hour period of time, because in between he needs a break, because from a mental health perspective and for anxiety or just wanting to do something else that's fun, you need that break in between medical interventions.
Another question is, do you have any specific suggestions on finding a provider who will take your child as an adult?
Right. That is tricky. And so I think there's oftentimes it's word of mouth. So you know another parent who has a child who has needed a specific specialty, and then you've heard that somebody is good, and then that provider becomes the default go-to. And there's nothing wrong with that. Like, if a provider is willing and able and has a capacity, that's great. One of the other things you can think about doing is having your pediatric provider help you create a medical plan that kind of summarizes everything that your child has gone through. Obviously, for a lot of children, when they hit like adolescence, young adulthood, they might have a lot of medical information and their charts are really thick, and no medical provider in the adult world is going to sit and look through that. So trying to figure out what's the most pertinent information to tell your story, and then look and see if, I mean, it's probably doing a lot of calling around to different providers, but if you're able to tell them, we have a provider who's also willing to work with you. So trying to engage the pediatric provider to be willing to talk to and work with the adult provider, or maybe even have the pediatric provider be the one to phone the adult provider and see if they're would be open to establishing that relationship, and then looking to see if there's even an opportunity to almost do like a meet and greet. Because sometimes when you're looking at somebody on paper, they can appear overwhelming, and then you meet them in person and it's completely different from what it looks like on paper. And then, you know, especially when we talk about pediatric diagnoses, a lot of adult providers only trained in adult conditions, and so they are afraid to even touch a pediatric patient who has a childhood disease that they've never heard of. So doing education and helping them understand, because not all childhood diseases are necessarily going to influence what happens as an adult. It might be a condition that's a stable condition. Yes, it happens in childhood, but you've still got this adult who needs adult care and will have adult issues that can no longer be taken care of in the pediatric world. So I think trying to figure out if your pediatric provider can help with some of the education as well for the adult provider, because they have a way of being able to explain your story and your child's story, and often they've been with your child for a long time, so they have all that knowledge in their head. But it's also, I mean, it's also really hard for anybody to let go. There's lots of pediatric providers who have spent a lot of time and energy trying to get children into adulthood. So it's a great success that we're now worried about trying to get them into adult care. This is exactly what we wanted. We want children to be able to live well and live into adulthood. So it's also helping adult providers feel comfortable with some of the things that our pediatric providers see every day, so it's not that big of a deal for some of them. So this is a small guide that I've put together, and it's kind of is a starting place. The idea is basically to try and help adolescents, parents and providers think about some of the key things that an adolescent needs to know and work on in order to become more independent with healthcare, especially as they move into the adult world. And we have really great processes in school to help with moving through school and into workforce. And we have all kinds of transition for vocational rehab and all of those kind of services, but we don't really have anything for healthcare. So the idea behind this is just having even a simple checklist that you can work through and see things like, can I name my allergies and do they interact with the medications I'm on? Or if I go to the doctor because I'm sick and they ask me what medications am I on, am I able to even say what I'm on? And with modern technology, you don't need to remember this stuff. Everybody has a smartphone. So I encourage people to take a picture of their medication bottles.
That's a good idea.
Right. And then when you go to the doctor and they say, what meds are you on? You're like, I don't know, but I have a picture of them all, so now you can see. And probably from that, they can also kind of tell them what medical conditions you also have. But in here, especially for adolescents, there's goals and objectives, so it helps with working to be able to complete the checklist in terms of, write down 3 facts about your medical condition. So it could be something like you're not able to drive because you're on medication that makes you sleepy, so you wouldn't be able to drive. So then if you're looking at, well, how do you get around to go to school or for a job, or just if you want to go out and meet your friends, okay, you're going to have to learn transportation. So is there transportation near where you live? Can you ride your bike somewhere? Can you ride your bike and take the bus and do a combination of the two? So then that would be the skills that you'd be looking to try and work on. There's also in here a responsibility chart. So one of the ideas behind this is, if you think about when you have children, from when they're born, you start to teach them skills, and you do it automatically because that's how kids learn, and then that's how you give them independence. So you help toddlers learn to dress themselves, teach kids how to tie their shoes, so eventually you don't have to tie their shoes, or just keep buying Velcro shoes, whichever. But you teach them how to brush their teeth. It's the same with learning how to do medical things. If you're engaging kids in and asking them to take medication, how do you help them to learn why the medication is important? And talking about how does it help their body to be healthy, and what would happen if they don't take it? So that the hope would be, by the time you get to be a teenager, you're not having an argument over taking medication. That doesn't become the thing you argue over. You argue over what clothes they're wearing or what time they're coming home from being out with friends, rather than over medical stuff. And it's also this idea of helping parents who are very engaged often with the medical care, and being able to let go and allow the adolescent within a controlled environment to learn how to make good decisions for themselves, in a way that they're not going to fail and it's not going to be really detrimental, with the idea that when they turn 18 and they are making these medical decisions for themselves, they already know how to make a good decision, or they're willing to risk taking the responsibility of making a poor decision, which can be a really hard lesson to learn too, and one that as adults we don't want adolescents to fail, but sometimes we need to figure out the balance of. All right, so this guide is going to be available on Stone Soup Group's website, and the download instructions will be in the comments section, so feel free to download and use and share. And if you do have a child who has a healthcare need, you can also think about, is this something that you can share with their school nurse or teachers, so that way adolescents are having more control over some of their health needs and are able to advocate and talk about what they need in order to be healthy when they're doing their day-to-day stuff in school as well.